Hi, everyone. Hi, everyone. I'm Dr. Lisa Palmer, Dr. Mama Bear, coming to you live on quantum nutrition testing. What is quantum nutrition testing? Where did I learn it? How do you do it? What is this stuff? Like, what is this quantum nutrition testing that you hear us talking about, that you hear your friends talking about, that your friends are telling you that you should like totally go see this office in Central Florida and get quantum nutrition testing? Like, what the heck is this stuff? So let me know if you guys can hear me. I've been having mic problems. So everybody on Instagram, I know you guys can hear me because it's a different feed. But those of you that are on Facebook or Mama Bear Live or Telegram or Brave TV, let me know you can hear me okay. Just put a little line saying that you can hear me, or you can tell me where you're coming from, so we can get this party started. So I'm super, super excited about this week. I've been a mix of emotions, actually, as far as my feelings on it. It's a mixture of excitement, like a lot of excitement, stress, concern. I've had moments where I was like, what the heck was I thinking? So those of you that are on Facebook, let me know again if you can hear me. Just comment that you can hear me or not, so I know that we're good. So it's been a whole stream of different emotions. And so some of you guys know exactly what I'm talking about and why I'm saying that. And some of you guys are not knowing why I'm saying that. And so I guess to really fully understand what I'm trying to say, I'll back up a bit and let you guys know what happened. Okay, cool. Jean, thank you, Jean, for letting me know that you can hear me. Hey, Jean, it's been a long time. Jean's awesome. What the heck? How did this all happen? And so some of you guys know the story, and some of you guys don't know the story. And so I'll keep the story shorter for those of you that already know the story. But in the middle of the pandemic, my father had a stroke, and it was extremely scary times because we didn't know, I'm a physician, a chiropractic physician. My husband's a chiropractic physician. My mom's a registered nurse. And so it was a time where the hospitals were closed, and basically they were telling you if you couldn't come in at all, like no visitation, right? Zero visitation. And basically just go if you're dying, right? And so we were very tentative about having my father go in the hospital because at the time we didn't know he had a stroke. At the time, he had just slipped in the middle of the night and possibly hit his head. And so my background, sports medicine, I was on scholarship at the University of Florida. Go Gators! And so because of my undergraduate degree, I have a bachelor's of science and exercise science with a specialization in sports medicine. So basically from high school on, I work with athletes every single year, every single season, until I had Leah, right? So on athletic sidelines in ice rinks for a really, really long time. So a lot of the sports that I worked, soccer, rugby, ice hockey, college football, are sports that are high in concussion, right? A lot of people think that soccer is not high in concussion, but it is. When you jump up and you do what's called a header, where you hit the ball with your head, that's not what causes a concussion. What causes the concussion is when someone jumps up to get the ball and someone else jumps up to get the ball, and now it's head to head. That can cause a concussion. Or when the goalie comes out and you collide with the goalie and the goalie collides with you, or if you hit the sides of the goalposts, that's concussion material right there. Ice hockey, it was just guys fighting all the time. I'm like, guys, we only have so many players, and if you guys keep getting in fights and you get injured, then we don't have enough players for this tournament. So that's the main injuries in ice hockey. Checking into the board, if you've been playing hockey for a while, you know how to take a hit, you know how to give a hit. So that's not the cause. And then rugby is just insane. Rugby is like football with no pads. The cool thing about rugby is that you have to have clean tackles. You can't have messy tackles. A lot of American football players get injured because they get sloppy in their tackles because they depend on their equipment. In rugby, they have clean tackles. What happens a lot in rugby is it's bloody, right? Because you get a knee to the head or you get an elbow to the scalp, and now the scalp's busted open, or a lot of things around the eyes, right? So when it comes to concussions and head injuries, I think I'm pretty good, just because of the decades of working on sidelines as team doctors or as student athletic trainers, and in the sports medicine field. So I was pretty confident when my dad called me over and said, hey, I hit my head on the nightstand. I'm like, all right, let's evaluate for concussion. You're looking at the pupils to make sure that they're even and they're reactive to light. You're checking memory, past, present, and future. You're checking communication. You can have them do some math, like some basic addition. You can have them divide. You can ask them questions from the past. You can ask them questions that are relevant right now. And you can ask them questions like, what would happen if you added 4 years to this year? What year would it be? Stuff like that. And some of you guys are like, I don't know. What year are we again? The other day I wanted to write 2033. I figure if we go 10 years ahead, it's a better time. That's my prayer, right? So I'm doing all that, doing all the concussion evaluation, and he's answering like a rock star, passing all the tests like a rock star, all the cranial nerve tests, no problem, making jokes, no big deal. So I'm like, you know what? His vitals are good. He's not testing for concussion. Let's just, keep assessing him. It's very, it takes stress off knowing my mom's a registered nurse, worked at public hospitals down in Miami, worked in, she's just had an amazing career, 40-year nursing career in, you name it, dermatology, breast health, immunocompromise, radiology, dermatology, just so many different floors. And so I felt really confident, one, with my evaluation, two, with Dr. Dean or my husband's evaluation, three, with Sohaila's evaluation, and then my mom was there as well. So anyways, long story short, I'd say maybe day 2 in, he started going the wrong way, right? And so all those good indicators with memory and communication and joking around and all those things changed 2 days in. And 2 days in, we started to notice that his face started to droop. And now I'm like, oh crap, like what's happening? Like, did something happen since this accident? Did something happen because of the accident? Like, what the heck is happening? And he was having difficulty moving his arm and moving his leg, moving his body. So holy crap, right? Like, what do you do? And so it was that mental chess game of, one, it's your father, right? It's my father. And you don't want to make the wrong decision, right? And so to be put in that place, those of you that are medical power of attorneys, those of you that are medical proxies, those of you that are in charge of your parents' healthcare, those of you that are parents, it is an uncomfortable situation. I'm sure a lot of you guys have been in that situation. It's an uncomfortable situation to have to make healthcare decisions for a loved one, right? And it's even more complicated when the decision is not a normal decision, because if it was normal times, I would have been like, all right, let's go get you evaluated. Let's run an MRI on your brain or CT on your brain and just make sure things are cool. But during that time period, hospitals were basically closed unless you were dying. If you couldn't breathe or it was like you were in really bad shape, then they said, go to the hospital. Everybody else, remember what they said. What did they say? The media said, stay home. Right? Which is not good advice when people have problems. And it actually led to the intensive care units. You guys all remember this. The intensive care units were full. People were waiting too long to handle things that if they were caught earlier could have been handled. And so we made the call. We called an ambulance because at that point he was having difficulty walking and weight bearing. Moving. And then when the face started to go, I said, all right, we got to get him in. So transported him in, went to the emergency room. They ran imaging. There was a brain hemorrhage. And the docs were debating, should we drill a hole in the skull and drain, right? Like, doesn't that sound so barbaric for this century that we're in? And what's crazy though is I think because we assessed him and we evaluated him, I think because we waited, actually the body started healing. And then it made me wonder how many people go to the hospital and they see hemorrhaging and they want to drain it right away. And how many times is that done where they could have just waited to see how the body healed? So he never had his brain drained. He did end up staying in the hospital for a whole month. It was in intensive care. The hospital staff was very kind. The rehab staff was very kind. But how quantum nutrition testing is related to my father in the hospital is because quantum nutrition was not something that I was looking to develop. It wasn't something I was looking to teach. It wasn't something, this was not in my wheelhouse. Like this was not something that I wanted to do. In this time during the pandemic, we were just looking to survive, right? Like we went from almost 600 patient visits a week down to 100. I had those tough conversations with Dr. Dean on, what do we do with our staff? These staff are like friends and family, like they're like my sisters. Leah considers a lot of our staff her aunts. They've known her since like she was born, before she was born, right? And so it's a very stressful situation as a business owner to look at the numbers and realize, all right, people are staying home. People are told to stay home. People are wondering who's essential. And people were reluctant to come in, even though at the time at the office, we had outside chiropractic and we had outside nutrition. So it was very, very stressful time. At that moment in time, I was not looking to develop a nutritional technique. I wasn't looking to add anything to the business. I was just looking for the business to survive. And so two things happened. The first thing that happened was my husband is freaking amazing. A lot of you guys know us from listening to his show on Brave TV. He started going live every single night and was giving people a hope and giving people help and spreading the truth about what was happening during this pandemic and spreading the truth about what was happening with the government and spreading the truth about what was occurring and giving people a different viewpoint from what they were hearing from the media, and ended up getting an international listener base, and which is so cool because some of you guys, hi our Australian friends and our California friends and New York and Maine and Michigan, all over, right? So that was cool. We started having, he started having international listeners and influence, in a positive way and helping in that way. And then, while this is occurring, my father's in the hospital, right? So we're checking in with the nurse every night, and I'm in every night, my mom throughout the day. And one night I was awake, and I still don't know the right word. You guys got to help me with that word. I woke up at 3 a.m. and I got like a message. So, you can consider it angelic. Some people would consider it like telepathic. Whatever you want to consider it, it woke me up. And the message was, I need help. And I'm like, who needs help? Why do you need help? I'm like, it's freaking 3 a.m. and I'm tired. Like, I got it. You need help. But what am I supposed to do? I'm in bed and I'm in my pajamas and I'm tired, right? Alyssa says awakened. I was awakened. Thank you, Alyssa. I was awakened. And it was a very strong message. Like I admit, Dad, if you're listening, I'm so sorry. I tried to ignore the message because I was tired. But I couldn't. And I was like, I'm in pain. I need help. I'm in pain. And I'm like, who's in pain? And then I realized, I was like, oh my gosh, this is my father. And so some of you guys right now know exactly what I'm talking about. And some of you guys have had that happen to you, right? You got a message from a loved one, but they weren't in your house. They were somewhere else. I know that there's a lot of functions in the brain that we are not aware of, right? When I was at the University of Florida, they opened a brain institute, and they were so proud that they knew maybe 3 to 10% of its function. 3 to 10% of a brain function? Like, okay, what about the other 90 something percent? Like, what does that do? It just sits in your head and your skull and just hangs out? No, I don't think so. And so I got this message. It was super strong. Realized it was my father, and felt helpless and felt desperate and didn't know what to do about it. And what do I do? Right? Like, it's 3 a.m. He's in the hospital. He's got a nursing staff. He's got a doctor staff. He's got people around him. He has a call button. Like, what do you want me to do, Dad? So I thought, well, if I can do this nutrition testing stuff that I've done, for over a decade, if I can do that live, what if I could do it at a distance? Like, what if that was a possibility? And it wasn't something that I had done before, but I was so desperate, and the message was so strong that he needed help, that I was like, well, I could try, right? Like, this message is screaming in my face. I could try. So using intention, using prayer, using however you want to describe it, I started to go through and scan visually in my mind's eye, right? Scan different organs and different glands. So different parts of the brain and the face and the organs and the glands, right? And then through this type of distance testing, determined that there was a problem in the kidneys. Now, I think what makes it a little bit easier the first time I tried this is that my dad and I are really, really close. And I've helped with my dad's healthcare for as long as I've been in chiropractic. So I graduated in 2004. So before that, I was helping him with whatever I could help him with. And then definitely since I came back to Florida 2005 on, I've been his primary healthcare provider from a chiropractic and nutrition standpoint. And in his 70s, no medication, which like totally shocks medical doctors. They're like, you're 70, whatever, and you don't take medication. And same thing with my mother, right? So the cool thing is associate practitioners help me now, which is great because it's really hard to take care of your own family. And so scanning and found a problem in the kidney, and found out that there was a kidney stone, and that was blocking his ureter, so you have your kidney, and then you have the tube, and then you have the ureter tube into the bladder, right? So, and his bladder was causing him pain. The next day I found out that his bladder was like, I don't even know how many times bigger than it should have been, right? And so not only did I test that, but I tested to see what supplements could help him. And then I took the testing a step further and found out what dose could be added, what kind of doses could help, right? So supplements don't treat anything. Supplements don't cure anything, but our body needs nutrients and vitamins and minerals to survive. Every function in the body needs a mineral. Every function in the body needs a vitamin, right? So that's why they say vitamins and minerals are so crucial. Or your electrolytes, your little tiny cells, have sodium and potassium channels. So when docs tell you sodium's bad, I don't know what they're talking about. I don't understand, because you need sodium for the cells in your body to function properly. Now, they could be talking about table salt. Table salt's not good. Table salt is devoid of minerals. It's bleached, right? Or your salt on your Lay's potato chips, right? That would be bad. That would cause inflammation. That would cause you to be puffy. But sea salt or Himalayan salt, that's good salt. That has minerals, and you need it for your cells to function. Some of you guys are exhausted right now because your sodium and potassium ratios are really messed up. So testing to see what he needed, I'm like, well, how am I going to get this to him? Because in the hospital, they don't like you to take extra stuff, right? So like, we always have some fun supplements around. So this is Para 2, right? So how would I get this to him? Could I give it to the nurse to give him? Probably not going to happen. Nurses are overworked. And they would need clearance by all the doctors on the case. So then I remembered, I was like, wow, when you're at the hospital, your family can drop off cookies for you. And your family can drop off donuts for you. Your family can drop off Coca-Cola, candy, like all this stuff. So I was like, wait a second. If your family can drop off sugar, and sugar has a negative effect on your health, and the doctors are cool with it, then I don't see why there's a problem if I dropped off healthy stuff. So my mom was freaking amazing, and every single day dropped off my father breakfast. And in the breakfast, she would put organic goat milk or organic goat yogurt to try to help his gut repair, because he was given some antibiotics in the hospital. She would give him nutrients to help rebalance his system. Okay. So, and then Dragonfly says, yeah, the hospital and every other person's always suggesting Ensure. Yeah, I don't know why. I do know why. It always comes to money, right? But when you get to be a certain age, they think Ensure is the best thing ever. And it's not. Like, it's all synthetic vitamins and it's high fructose corn syrup. It's like diabetes in a can. And then what really drives me crazy is Pediasure. Pediasure is bad too, right? Pediasure is like a crappy milkshake with fake vitamins and artificial sweeteners and high fructose corn syrup in a container. Like, it's awful. It is like horrible, right? So they're trying to get him to drink that, by the way. So long story short, I started distance testing him, and we were giving him his supplements and his breakfast. He got better and better, got released. He's walking now. He's doing great. He's moving his arm. He's trying to play his clarinet. He's frustrated because he was a very, very good musician. He played in the U.S. Army Band and was like amazing. And that left arm isn't working as well as it used to. So he gets frustrated, but he's still trying. And so I'm very proud of him for that. And then I realized that if I could do this for my father, we started getting all these phone calls like, can you help my mom? Can you help my dad? Can you help my grandma? Can you help my grandpa? Can you help my neighbor? Can you help my niece? Can you help my nephew? Like, we were like frontline triage for not only Central Floridians, but for people all over the world. And it was freaking these last 2 years. And I am sure you guys feel the same, have been insane. Like, they've been like crazy, right? So we started doing telehealth. We started taking information over the phone and doing telehealth. And we were guessing what people needed. And then I realized guessing is not good enough. What if we test? So the quantum nutrition testing, the testing I did on my father from my house to the hospital, it's like, well, if I could do that there, why can't I do it for patients that need our help in other locations? And so I remember one guy came in. Actually, he was so afraid. He didn't want to come in the office. So he told me all the things that were happening, and using my doctor brain, just like your other healthcare providers do, they use all the knowledge, they use all their experience to guess what the patient needs, right? So this guy's telling me he has problems with this and anxiety and all these things. And so based on what he's telling me, I'm like, okay, well, this supplement can help balance him out, and this supplement can help balance him out. And I had like 5 supplements that I thought would help him. But something told me like, it's not good enough. Like, I had that unsettling feeling that wasn't like, I don't like just to guess. Like, I could say, hey, para 2 could be your thing, but I don't want to guess, right? Like, to me, it's not good enough. And so the guy was on the west side of Orlando, and I said, hey, you're local. We're working with people from all over the place. You're local. Can you please come in? I know you're afraid to come in, but if there's any way you can please come in, because I put a personalized program together for you. But we typically muscle test this. And I would love to muscle test you to see how like, to make sure this is right for you. Because if you're going to spend money, I want to make sure that we have the best program for you. And the guy's like, well, I really don't want to come in, but if you really think that I should come in, I'm going to come in. So the poor guy was mortified, right? He had ski goggles on. And so it was very, knowing that the germ theory is false, and knowing that masks don't work, and knowing that if you're going to wear gloves, anything that touches your hand, it's just going to pick up on your hand. Whereas the oils and the good bacteria in your skin are going to fight off funk, right? So he comes in with ski goggles and a ski mask and ski gloves, right? And then this is Florida, and it was not that cold out. And so he kind of looked ridiculous. And I felt my heart went out to him because he was so afraid. But I was so proud of him for confronting his fears and coming in. So not only is he afraid to leave his house, now to do muscle testing, I have to actually touch the guy, right? So I'm like, look, I got to do this thing where I touch your arm and then I touch different points, and hopefully you're cool with that. And he's looking at me like, what are you talking about? I'm like, if I can do this, I can give you better answers. Out of the 5 supplements that I used my big doctor brain, my 9 years of college, and my thousands of hours of nutritional seminars and sports chiropractic seminars and CEUs, continuing education credits and all that stuff, out of the 5 supplements, guess how many I got right? I got 1 right. 1. I only got 1 right. That's not good enough, right? To me, that's not good enough improvements. Would I have hurt the guy? No, it was whole food nutrition. But would I have helped him the way that I wanted to help him? No, I wouldn't have. So I realized at that point between my father's case and this local guy's case, I'm like, we can't guess. Like it's better than nothing. It's better than waiting until you have big problems, right? But it's not good enough. And so we developed the technique of the quantum nutrition testing, where we can test from anywhere. We can test to see what is the cause. Is the cause coming from a bug, like a parasite, or bacterial, or limes? Is it coming from mold? Is it coming from a chemical? Is it coming from metal? Is it coming from radiation? Is it coming from stress? Is it coming from shedding? Right? So we're looking for all these different causes to what happened to the person. We're evaluating what areas of the person's physiology, what organs are working optimally and what organs are not. And it's really not that far-fetched. Some people are like, what the heck are you talking about? But when you think about it, if you go to a cardiologist, what do? They stick electrodes on your chest, right? The electrodes don't touch your heart muscle. You got a chest muscle here, you have ribs here, right? You got a lung there, but somehow the magical electrodes that you guys all are okay with, right? The magical electrodes send a signal from your chest, from the outside of your body to your heart. It picks up on the signal of your heart and it makes a graph, right? And everybody's like, oh, that's cool. Yeah, but how does that work? How does your cell phone work? I can call you right now. Some of you guys are watching me on your phone. I can call you right now and somehow you can hear my voice. I can text you. How do my words get to you on your phone? Do they fly magically in the air and then land in your phone? And then get this video. How is my video flying? It's like Wonka Vision. Remember Willy Wonka? How is the video getting from, this is running on a laptop. I got my audio on the mic. I got a camera there, right? We're streaming it. So how is this going through you guys on Instagram, you guys on other channels? How are you guys getting my audio? How are you guys getting the Vizio? How are you getting the vision? How are you getting the picture? How does that work? And most adults, when I ask that question, if I were to send you a video from my phone to your phone and my phone's not plugged in, how does the video get from my phone to your phone? Well, the simple answer is it's frequencies, right? So sound is a frequency. And color is a frequency, and those frequencies get transmitted from here in Central Florida to you in Indiana and in Nebraska and in Maine and in Australia and California and Texas and from wherever, right? Wherever everybody is. And that's freaking amazing, right? So with quantum nutrition testing, we're just tapping into those frequencies. It's nothing evil or bad or horrible, right? We're just using those frequencies to assess how well organ systems are working. And if something is not working, we're matching the frequency. So again, say I'm using para-2 as an example. I'm matching the frequency of para-2 to the frequency of the problem. And if it matches, we get a change in muscle response, just like the EKG has a response. If it doesn't match, okay, cool. Then we select a different frequency. Para-1 has a different frequency. Does this match with the problem? If it does, I know Para-1 is going to fix the problem. If it doesn't, okay, fine. Then I'll use something else. So then I can use biotoxin binder, right? So basically, we're playing a matching game all day long from everywhere. And balancing out the body, finding the cause, balancing out the body with whole food nutrition, herbs, and carbon technology. Super cool. So that's where quantum nutrition testing, how it got developed, why it got developed, and working on, and the proof is in the numbers, right? We grew during the pandemic. The practice actually doubled. We have patients from all over the world, right? With every single condition you can think of. So I was training new staff the other day and they're like, well, can you help with this? And I'm like, yeah. Can you help with this? Yeah. Can you help with this? Yeah. The only thing we can't help with is if you have a huge cut and it needs to be sutured, I can't do that for you. If you got a bone sticking out of your arm, you need to go see an orthopedist and have that set. But every single other condition, all it means is that there's an imbalance in the body. We have to figure out why the body got imbalanced, remove the cause, give the body the appropriate nutrients, probably make some changes in your food because everybody tells me they eat healthy and then they tell me what they really eat, right? I realized that there's two words in the English language that have really bad definitions. One is healthy. and the other one is normal. So I don't know if you guys would agree with that, but like normal, I hate that word. I know you shouldn't hate. I dislike that word strongly. Normal, like the new normal, screw that. That's their normal headache. I don't like that. And then, so normal, I don't like. And what did I say the other word that I don't like is? I forgot. Brain farted. So normal is not my cup of tea. It is not. Healthy, because normal, like everybody's like, oh, that's my normal headache, that's my normal migraine, that's my normal this, that's my normal that, right? Thank you, Emily. Healthy. And healthy, like everybody tells me they're healthy, and I'm like, but you had cancer. Oh, I'm healthy, Dr. Palmer. Our grandma's healthy. I'm like, she's missing organs. Like, that is not the definition of healthy, right? Definition of healthy isn't that you're going to drop dead. The definition of healthy is 100% of your organs and 100% of your glands, 100% of your parts are working optimally. If you don't have a gallbladder, you'll never be 100% healthy. If you're missing half your thyroid, you're never going to be 100% healthy. It doesn't mean you're screwed. It just means that you're missing organs and glands, and someone missed the cause on you, right? Someone didn't find out what was wrong with your gallbladder. A lot of times it's because there's a parasite that likes to live in the liver, and it swims from the gallbladder to the liver, to the gallbladder to the liver, to the gallbladder to the liver, and it makes the tube, the duct, sludgy and irritated because there's it's traffic, right? And it poops and its waste just gets in there, and then it has babies in there. And it's just, I mean, they're really disgusting creatures, right? And so something bothered your gallbladder. I would vote parasite. I'd bet you $1 million parasite. Your gallbladder got sludgy. It made stones. It lost its flow, right? It got stagnant. It got necrotic, meaning it died. You had pain and they took it out, right? They saved your life because they took out a dead organ. Well, in a more ideal situation, we would have determined earlier that you had irritation in the gallbladder. That's why you hear Dr. Dean say, hey, do a parasite protocol. Why? Because it is the number one most neglected thing that American doctors don't pay attention to. I would say international doctors don't pay attention to either. They're just a little bit more aware because they understand that parasites exist, because malaria exists. They understand parasites exist because Chagas disease exists. They understand that parasites exist because trichinosis exists. They understand that parasites exist because they've had a patient with liver flukes, right? Whereas US doctors, they're not really looking for that. And I am quite sure. I love when I say I don't know why. And then I'm like, yeah, I know why. It's because, ivermectin's super cheap. Hydroxychloroquine's super cheap. Antiparasitic medications are super cheap, right? And they're super effective, and they've been around a long time. Now, I'm not advocating, if you've never done a parasite cleanse, to go get some ivermectin, right? We got to make sure that your gallbladder and your liver and your kidneys and your lungs and your bowel are all detoxing properly. The people that had problems when they took those drugs, one, they probably took the wrong dose, and the studies were done with the wrong dose, by the way. And those patients also had clogged up lymphatic systems, and they had clogged up detoxification channels. You can't detox bugs or chemicals or metals if you're all clogged up. So we teach you to unclog that. Okay, cool. So I'll take some questions. So that's how I developed Quantum. That's why I developed Quantum, was to save my father and then help everybody around the world. Why do we do it? Because it works. Who does it? All the practitioners in my office learned it. We all do quantum nutrition testing. And then what are we doing this week? So some of you guys are on your way down. Some of you guys have flight schedules. Some of you guys are mad at me because you couldn't get into this class. So we're looking at July and August. The July dates we're looking at are July 15 and 16, or the last Friday and Saturday in July, which I think is 29 and 30. So 15, 16, 29, 30. So you guys can vote. Which one do you like better? And I'm reading your votes so I can secure the space, the seminar space. And that one's going to sell out again too. And that's okay. And that this class and the next class, I'm also training instructors, right? Because we we have, and you guys, if you're on this feed, agree with me, we have a crazy planet. The numbers look horrible as far as people having cardiovascular events. Some of that is because of the experiment. Kids, more and more kids I'm seeing with obesity, more and more kids I'm seeing with diabetes, more and more patients with autoimmune diseases, more and more people with chronic horrible conditions, more people exhausted, more grumpy moms. Like, grumpy is not a diagnosis, but if you're a mom and you have kids, you owe it to your family to be healthy and happy, because if you're a grumpy mom, guess what? Then you have grumpy, irritable kids because you're a grumpy mom. And that spreads over to the family unit, right? So then spouses are negatively affected. And that's why rates of divorce and other problems go up, right? During the pandemic, the opioid painkiller numbers were up. Alcohol consumption and drug consumption were up. Why? Because you took productive people and you told them to stay home, and some of those businesses that they work for shut down, and that's really criminal. Like, this is more than an immune problem. This is a societal problem, and you guys are, well, if you listen to Brave TV, you're well aware of the craziness. So we need other practitioners. We need people that are going to, that have it in their mission, that have it in their heart, that have it in their soul. We need people to apply this technology to their friends, to their family, to their neighbors, to their community, and increase the health. Because when you have a mom who's healthy, she is pleasant to her kids. She is pleasant to her husband. She is pleasant to her community. She has the energy to serve, whether she's a teacher or a doctor or a lawyer or a landscaper or whatever the heck she does it better. But when she's grumpy and she's tired and she's irritable, and I hear you, because I was there too at one point, you're not a nice person, not because you want to be a mean, old, nasty, you know what? It's because your system's failing, right? And my system was failing. Some of you guys know the story. My system was failing from mercury toxicity. My system was failing from mold toxicity. My system was failing from parasites, right? And so traditional medicine failed me, even though my parents worked in traditional medicine. Traditional medicine failed me, and I would have been a goner, 10 years ago. Okay, so I have some votes here. So Lola asked, do you have to have medical experience? Absolutely not, Lola. You do not have to have medical experience. I will tell you that some of the supplement companies that we utilize, you need to have some kind of license or degree to purchase, because they only sell to licensed healthcare providers. So there's ways that we're going to help you guys with that. And there's kind of two tracks. There is the Mama Bear telehealth coaching track. And there is, oh no, my screen froze. Okay, there we go. And then there is the practitioner track. So if you are already a chiropractor or an acupuncturist or a medical doctor or a physical therapist or OT, occupational therapist, or a nurse or a massage therapist or whatever, you have a license to work on people, you would be in the practitioner track. If you do not have a license to touch people, you will be in the telehealth track. Now, you can go from telehealth track to practitioner track. It depends on your state law. Georgia's super open for nutrition, right? Florida's super open for nutrition. I don't know all the state laws, but if you want to do this, if you want to help, one, you can help your family, because what you do in your house is your business, right? But two, if you want to do this for a profession, we will help you figure it out, okay? So Lola, no, you don't have to be medical. Let's see. Alyssa, later July date also works. You must have posted something earlier, which, let's see. Sarah says 29 and 30. Hi, Sarah. Sarah's an amazing practitioner in Iowa. Nina says the 29th and 30th. Oh my goodness. Okay, got it. So I got a couple votes for 29, 30 of July. Let's see. Cindy says August. I know, Cindy. It's so funny. I've been doing this vote through social media or on the phone, or people asking me, and I'm like, all right, do you want July? You want August? And it keeps like going 50-50. And I'm like, oh my gosh, am I going to make a July and an August class? Is that what we're going to do? So Alyssa says later July. How do people who aren't practitioners help? We can be runners for you. Yeah, you could be runners. I need administrative staff. I need more managers in the office. I need a reception. I need good receptionists. We're still short staffed. So if you are calling my office and if the phone rings too much, I am so sorry. That is not how we want things to work out. It's just we are still short staffed. Amanda and I were working really, really late on Friday night trying to get everybody's orders out and catch up for the week. And it's crazy town in a good way because we love helping people, but we do need more help. All right, it's Dragonfly. Doesn't Kids Protocol come with a liver drainage product too? Yes. Anything that's a tone, Dragonfly, is drainage, right? So if you have the amoeba cord in the drainage tone, anything that says tone, drainage tone is drainage. So that keeps the lymphatic pathways open. Gogo says, I find the quantum testing so fascinating. I look forward to taking the training in the near future. Awesome, Gogo. So just keep posted on the lives and we will let you know when that's going to happen. Lola says, should we expect to walk away with knowledge and ability to practice quantum? Hell yeah. So here's the stressful part. So I started off saying like, it's cool that this is happening this weekend and it's stressful and it's fun. But, you know, I've been working on the course material for, I haven't stopped working on it. As soon as we decided that this is what we're going to do, I've been working on it every day for months and months and months and months and months. Because for me, if I'm going to ask you guys to pay money, to leave your families, to fly or drive down here, you are going to leave with a new skill, okay? But like any new skill, if I handed you a bicycle and you haven't rode a bike in 20 years, you're probably gonna be a little bit rusty. If you never rode a bike, you're probably gonna fall. So the good news is you're not gonna fall, but it's a new skill and you have to practice it. So I'm gonna give you everything that you need to do it. We're gonna practice it in the seminar, but you're gonna have to practice it too, right? So if you guys want a sneak peek, here is the manual. And what it has in here is it has a whole bunch of goodies and the camera faded out and that's so mean because you guys can't even see it. So it has a whole bunch of goodies on mold and parasites and my camera got wonky. Here, let me see if I can fix it. I'm sorry guys. I don't know why that got wonky. There we go. And so it's still wonky. Come on, camera. Focus. Okay, good. All right. So yes. So my goal and my husband was kind of laughing at me and I was like, oh my gosh, like all these amazing people are coming and I want to make sure that every single person, whether you are a chiropractor or a nutritionist or a naturopath or a mom or a teacher or a physical therapist, like we have so many different cool people in the room coming from all over that you leave with tools that will help your community, that will help your patients, that will help your family, right? But I'm going to have like beginners and advanced people, right? And the cool thing is because it is a new technology, everybody's going to learn, right? And then there are clinical pearls, there are gems, there are pieces of technology that we came up with, right? That we came up with during this time to troubleshoot crazy cases. So a great example is, I don't know, 5 years ago, Lyme's cases, I was like, oh my gosh, it's another Lyme's case. Like, you want that case? I don't want the case. Like, we would not fight, but kind of like, a Lyme's case, right? And looking back on my Lyme's cases, I feel bad. You know, those poor people were suffering and I sucked at Lyme's. Like, just to be super honest, like if you were my patient 5 years ago and you were a Lyme's case, I'm so sorry. I sucked at Lyme's, not because I was trying to do a disservice. It's just the technology that we had was so limited. And then we ran into problems with parasites. You know, to the point where Jason and I were looking at designing our own parasite supplementation because people were having symptoms, but we weren't able to find out the cause. And then if we did find out the cause, we didn't have the tool to handle it. The Cellcore line's freaking amazing, right? So all those tough parasite cases, they're handled now, right? We have the technology to troubleshoot those cases. So we're going to teach you how you troubleshoot the difficult cases. You troubleshoot the Lyme's cases. You handle the crazy mold stuff. You find the crazy mold stuff, like super, super cool. So whether you are brand spanking new or you are like trained to the T in some kind of nutrition, this class is for you. And it is my goal to give you valuable technology that you can use right away. And we're going to use it in class right away. And it's going to be so cool. All right, so I missed some comments while I was going there. Hold on. My screen's giving me trouble here. Let's see. So Dragonfly is saying, anybody in Arizona going to this? So I don't know. I have the list memorized. Dental hygienist, sure, why not? We need the dental community. I was talking to a dental hygienist, was it yesterday? And she's so cool. She's very holistic. And I was like, you know what? I need dental hygienists and dentists to bring more holistic stuff to the dental community because, oh my goodness, like even if you're working in a dental office, the amount of chemicals and the amount of metals you're exposed to, even if you're in a holistic office, it's rough. It's hard on you guys. So teaching you guys holistic stuff that you could do with your patients, that would be super cool. Gogo says, Gogo likes August. Okay, good. Yes, it sounds like I'll have training for both months. Yeah, every time I get a July, then right after I get an August, and then I get a July, and then I get an August, and it's really funny. Just keep in mind, guys, July and August in Florida is hot. Now, we got air conditioning running everywhere, right? But it's hot. So just a heads up, I'm going to probably put a disclaimer. It is hot in Florida in July and August, so just a heads up. All right, Greta wants to work with us. Cool, Greta. My vote is yay, fry yay. Lucy, I'm not quite sure what yay is. Maybe July? Christy says, I'm coming down this week. Yay, Christy. Yes, you and your hubby, right? You have to say thank you. Oh, well, Brian, you're very welcome. Dragon says, okay, cool. Thank you. I'm down to 80 pounds. I'm down to 80 pounds. So I figure with the swallow issues, the kids liquid will, oh my gosh, you're down to 80 pounds. Well, we need to help you. Holy crap. That's not good. I don't know how big you are, but that sounds very low. Brian can't wait to come to the seminar in the future. So let me know, Brian, are you a July vote or an August vote? Lois says July. Okay, good. Tiffany, should I bring my supplements to test with? I don't think you need to, but if you want to, you can. Lady Cat says fluoride. Yep, fluoride's a big problem in dental. So is mercury. So is composites. So is chlorine. Alice says, I recommend people to your parasite protocol all the time. Oh, thanks, Alice. Okay, cool. So yeah, so sneak peek on the manual. So that is printed, ready to go for the weekend. Sneak peek on the cool hotel. We got pool, we got palm trees. It's pretty cool. The weather looks like it's going to be amazing. And so we are all set. So that is why quantum nutrition exists. It exists to help people heal naturally. It exists to be utilized. It exists to teach to whoever wants to learn it. And that's the plan. That's what's going to happen this weekend. So very, very cool. So I hang out a little bit and answer you guys' questions. Yes, there's going to be a class in either July or August, or maybe both, the way the votes are going. Yes, there will be some data online. So this is a hands-on technique, meaning that you, to me, anything that's hands-on is better taught hands-on, but there will be some online training. So if you want an introduction, there'll be some of that. If you need help, if you're a practitioner and you need help implementing it into your office as far as paperwork or patient care, difficult cases, marketing, that kind of stuff, that's all going to be online for you guys. If you want to be more on the telehealth side, there's going to be a whole program for the telehealth coaches. If you do not have a healthcare degree, that might be the first step for you, is start help coaching people. What you guys already know from what you hear on the lives, as far as the stuff you know about parasites and the stuff you know about heavy metals and the stuff you know about germs, you are way, 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 way ahead of most people in the medical space. I don't want to say all, because that's not right, but you are ahead of a lot of those folks. You do not realize how much you know. If I were to say, okay, all right, let's see. Okay, Tiffany, I'm going to put you up against this Mayo Clinic doc on a parasite case. Tiffany, you would kill the case in a good way. Like, you would totally help the person. And that other doc would spend thousands and thousands and thousands of dollars running tests and probably giving a lot of antibiotics. And you would totally, if it was a parasite case, you would totally blow that other doc away. Okay. So don't invalidate your training level. You guys have actually been training the whole entire time, and we've been training you for free, right? So every time I go live, I'm training you. Every time Dr. Dean goes live, he's training you. And the cool part about it is that you are all willing, awesome students, right? Like you want to learn. That's why you're with us Tuesday night. You want to learn. That's why you're with him during the day. You want to learn, for those of you that are on After Dark, right? So that's the best kind. Okay, cool. Sarah says, if there's an August option, that's my vote over July. Okay, cool. So August. Friday means yay. I'm coming on Friday, so it's Friday. Oh, Lucy, that's awesome. Friday. I love that. Well, I'm going to see you on Friday. If you want to stop by the office sooner, you're more than welcome. And Aggie says July. Alyssa McCool says, yes, between you and Dr. Dean, I've learned so much. Awesome, Alyssa. Alyssa, you definitely have learned a lot about holistic healthcare and how to help the body heal naturally. Calitude, although I'm not new to the information, learning about your channel and what you are about. Okay, cool. All right, awesome. Well, guys, thank you guys so much. Emily says, I did the Parasite Summit classes. My mind was blown away. That's awesome, Emily. Emily says, I wish my husband would move to Florida. Cool, Emily. Well, if you did, then come work with us. And if you don't, then maybe you could do telehealth coaching with us. Cool. Well, thank you guys so much for joining me live on quantum nutrition testing. I'm so excited. Those of you that are traveling down to Florida for this Friday and Saturday for the seminar, I'm so excited for those of you that are interested in coming in July and or August. As soon as the dates are confirmed, we have those 2 dates pending with the hotel. I will let you know and we'll open up registration. Just know we sold out in less than 2 weeks, like 11 days, and didn't run any ads and didn't do anything other than talking about it on our lives and telling some people that we talked to. That's it. So if you are interested, you definitely don't wait, sign up, don't hesitate, because it filled up really fast. And then as soon as everything's ready to go on the Academy, so a lot of the filming that we're doing this weekend will end up in the Academy. As soon as that is ready to go, don't worry, we will let you know. So do not be sad. Do not be sad if you're not traveling right now. I'm not traveling right now. And so for those of you that are in the same position as myself and we're not flying right now, I don't want to punish you because you can't come down to Florida because it's too far to drive. If you're living in California, I've done that drive. It is not fun. And so we're going to have some online stuff that you can start with. Okay. All right. Well, thank you guys so much. I'm so excited to meet you. If I haven't met you yet, I'm so excited for this weekend. Next Tuesday, we'll recap what happened and it'll be freaking amazing. Thank you guys. I'm Dr. Lisa Palmer, Dr. Mama Bear. Good night.